So good morning everyone. Today we continue with our gallery of medical devices. This is the third part with Dr. Adina. Inshallah, this will be the final part today, and we'll have a short exam after this part just to evaluate our knowledge of medical devices by now. Come on, Dr. Adina.
Thank you. So continuing from the last slide we stopped at is the laparoscopic adjustable gastric banding. This type of band is used for patients who want to lose weight for bariatric surgeries, and basically consists of three parts: the band with inner inflatable cuff and a connector or a tube, and the receiver port. Usually they put it under in the anterior abdominal wall at the left side. So by the X-ray you will see this gastric banding. The direction of this band, or the longitudinal axis of this band, should be within acute angle within the spine. Now there is an angle we call the phi angle, and should be less than 60 degrees, ranging from 4 to 58 degrees. So it should be lying oblique with acute angle, as I said. And then the tube that lie within the peritoneum, and lastly the port which lie at the left anterior abdominal wall. It's very important to realize this part. You should be below the diaphragm to the left side, and there should be no any air bubble at here, and this one should be not lying any horizontal or in different direction. By the CT, you might see also this band more clearly with inflatable part, because when they put it and they restrict a proximal portion, they inflate it so that it will be fixed in its side and does not move.
What they do, they just put the ring around the stomach to make it smaller, tighter. People eat less and lose weight. And the good thing about this, they can reverse it, remove it easily, first. Second, they inflate it, make it narrower. You can inflate it or deflate it.
Yes.
Just from the skin. Just make it more restricted or less.
Now one of the complications, because it lies in the stomach, is gastric perforation. When you see an extraluminal gas lying around this band, or if you see the band, for example in this case, the band is lying at abnormal position, it is more toward the gastrohepatic ligament, toward the wall or within the wall, there is extraluminal gas. For example, in this patient, she had increased abdominal pain after they put this band. You should suspect a perforation. This is one of the commonest complications, is a slippage of the band. So as I said, you realize here that the band lying at perpendicular to the spine, and if you measure the angle, it should be at least 90 degrees, and you find there is a gas bubble at here. So there's a slippage. If you comparison with the normal, you can see how it is in acute angle, more higher position, and there is no any gastric bubble or gas bubble in here.
It slipped inferiorly.
Yes.
Failed the procedure in this case.
Yes. As Dr. Ahmed said, this is the normal, how they put it. They tied the proximal portion of the stomach. But when there is a slippage, you can see how it descends downward, and the proximal part of the stomach will be start filling with air. So this patient, this is a fluoroscopic view of patient who had a barium swallow. You can see that the band lying here. With abnormal position, you can see also the gas fill this portion reaching about 4 cm. So also this is a slippage of the gastric banding.
Just one note, in case of suspected perforation, you never do a barium swallow. You do a low osmolar contrast medium swallow. Okay?
Also, this patient, he had the band seen slightly enter more to the wall. Part of it you can see start eroding the wall. So a tip, if you suspect any perforation or erosion, please review all the CT section reformatted sagittal coronal to see if there is any perforation. The last slide in this section, bilateral breast implant. Now we all see, most of us, the breast implant by the ultrasound, but the nice thing is when you by the X-ray you can see a very well defined, more radiopaque breast shadow you can see here. On the lateral view, also you can see it's very sharp lining to breast implant. This is the proximal part, and this is of the other side. It looks slightly larger because it is more clear, nearer to the X-ray tube. This is by the ultrasound. It's very important that when you see, always look for any signs of perforation, any fluid, any irregularity in the wall. Also by the MRI, this is axial T2 and sagittal T1 and T2. Weighted images. When you see slight amount of fluid surrounding the breast implant, this is normal. This does not indicate a rupture. Also, these lines, it's called radial folds. Also, it is normal, not meaning of perforation. Now, there is a lot of images in the Google. For the short of time, I did not put any. Now, talking about last part, which is the orthopedic devices. Starting from the head toward the pelvis and extremities. I will start with the most complicated device. It's called cranial traction tongs and hollow device. Now, first of all, the word tongs means that a tool that uses it to grab things. Exactly, this is the tongue. How does it look like? So they put this tongue around the head to grab it. When they invent this device, they put this tongue around the head and connect it to a heavy thing to grab the head out of the body. Basically, what they use this for patients who had any cervical spine fractures, or patients who had scoliosis, kyphosis, or basilar invagination when the spine entered too deeply into the skull and start to compress the brain stem and the spinal cord. So they grab the head slightly outward from the body to relieve this. With the new modification or advent of this device, they put a hollow device and a stand on the shoulder of the patient. Now, this patient allowed to move and with this stand on his head. So basically, this picture, all of this, this is the traction band. You can see the screws enter to the head in order to fix it in its position. This is outside the body, only the screws inside. And all this stand around the shoulder of the patient. Also, this patient had endotracheal tube and NG tube. Another interesting device they use it's called cervical cage. Now, the word cage is meant to also a small tool, sometimes small, sometimes it's larger. They use it to replace a spacer, replace the side of the disc when it is removed. There is another type of cage. They remove also the disc and the body. I will show you the two images. I'll start with the largest one. We all know the discectomy when they remove the damaged disc and also the osteophyte. They put a small cage in the disc. But sometimes they do operation called corbectomy, and they remove also the vertebral body when it is severely damaged in a fracture or whatever, or collapse. This allows to repair more than one disc level. So, for example, this is the corbectomy cage. It replaced the C3 and C4 cervical vertebral bodies, and they put a plate and 2 screws at C2 and C5 level. This gives excellent cervical fixation. Another type of prosthesis they use is called interbody fusion device. This is also a type of cage. Also, they use it in the disc, and with the 2 screws, they fix it in the above and below. Another type of fixation, it's called lateral mass plate and screws. This is the plate. Bilaterally, they put it. This patient had laminectomy, removing the posterior part of the vertebra, and they put these 2 lateral plate on both sides with screws. This is the screw how they inserted deeply into the vertebra. This is also another type of lateral mass screw fixation, also with screws entered posteriorly through the vertebral bodies or pedicle. This is how they look like, and this is by the X-ray lateral and P view. Also, this is another picture to approximate the picture and the imagination. Another type of lateral mass fixation, use it a patient who had odontoid fracture in order to release the pressure on the upper part of the spine. with a plate have been inserted into the occiput of the skull. This allows the odontoid fracture healing. So when you see this bilateral screws and plate and with a part of it into these occiput part of the skull, you should suspect or at least know this patient had odontoid fracture. Also, this is how they look like. As I mentioned earlier about the cage, this is another example of a smaller cage. They only replace the disc. So you can see for this patient who had pedicle screw fixation, also bilateral screw fixation, and between you can see this is small two metallic cage devices. They put it in here between two discs, between L4 L5 level. Also there is two transverse connector between the two line of screws.
So most of the times, the vast majority of the times, when you have these fixation plates and rods and screws, you will have laminectomy. This cage, it's a very common procedure. We see it very frequently in our practice. You should be aware of. You see in the MRI images, you see just two lines of hypointensity. These are metallic parts. And then the X-ray and the CT scan, you see these appearances a lot. Okay, and all of them is just, in fact, aimed for immobilization of this particular vertebrae. It's fixation.
They allow the fusion between two vertebrae to give more stability. This is also different shapes of the cage, some of them cylindrical looking, and this is by the CT, how they look like.
No, not every metallic is contraindicated. These are compatible metals. From titanium.
Yes, now they use the titanium, the old generation.
Not ferromagnetic.
Previous one contraindicated.
Not previous one contraindicated. When they started it, when they started the MRI, before, after they started the MRI. So all of them is not contraindicated for MRI. Don't worry.
Okay. This is another type of disc prosthesis also. This is more flexible type. They also replaced the disc for this patient who had C5, C6 disc replacement. This is also another type of the flexible type, because there is the fixed type and the flexible type, and each one has its own indication. So also this was an artifact by the CT scan. Another type of plates, they use it for the pelvis, called reconstruction plate and screws, for patient who had pelvic fracture, especially the anterior, with sometimes with posterior unstable fractures. Anyway, this plate with two screws in here, and this one is a long cannulated screw. They put it at the left sacroiliac joint. This patient also had intrauterine device. This patient also had Foley catheter. And if you realize, these are the skin staples for the previous surgery or previous opening. This is another type of plate, this one with 4 screws of different length. Another type also of plate, it's called 4-hollow implant or plate. Also they put it for patients with anterior diastasis, especially with unstable posterior injuries. It's basically the same principle, but of different shapes. Another type of plates, they use it for the extremities, this fixation plate with screws. For this patient who had lateral malleolus fracture. This also another type of plate. It's called a blade plate. It looks like a blade, and with تقريبا 95 or 90 degree angulated. Also with screws for patient who had diaphyseal fracture. This had non-union site, so they had to do internal fixation for this patient.
It's very common. We see it very commonly, these things. This you should know about.
Yes.
Fixation plates.
Another type of plates, it is more wider. This is how they look like for this patient who had also a fracture of both tibia and fibula. This patient also, he had, this is another case also with a fixator plate.
So the femur, I think.
Yes, of the femur, distal diaphyseal fracture. Another type of plate, it's called dynamic compression plates. Sometimes they adjust it according to the area that they want it. for this patient who had also radial head fractures and another distal fractures. This is another type of what's called T-shaped plate. Also, they put it for patient who had distal radial fracture. So you can see how they are different shapes according to the area that you want to use it for.
They can bend it according to the shape of the area of the fracture.
Yes.
That's why they call dynamic.
Yeah,
They
you
can
can't
just
use-
change the shape.
You can't use any plate and screw and not
Yes, yes, with the screw,
Should
of
be
course.
name of all of them.
Yes, this is the plate, as I said, and you can see screws. Also, this is another type of dynamic compression plate, also to use for distal radial diaphyseal fracture. This is AP and this is lateral view. Also, how they look like. Another type of plate, they use it for the hip specifically for patients who had femoral neck fracture, and this allow to spare the head or remove, avoid touching or removing the head. Also, this plate with a dynamic screw, they insert it into the femoral neck and to allow the healing of this area.
What I don't think, what's called dynamic hip compression screw is what happens every time the patient moves, instead of the head moves away or again, the fracture is more mobile, the screw just compress it more.
Yeah.
And the more the patient moves, the more the fracture is compressed, which allows for a better healing. That's why it's called dynamic compression screw. It keeps the head fixed with the neck fused, and every time it tries to move, it just compresses it even more.
Yes. Also, this is another example of patient who had also dynamic hip screws with a long to also additional screws for this patient. Another also example of a fixation plate looked like a fork, and they inserted also at the distal dimetaphyseal site of the distal tibia. Also, this is another type of bladed plate. This is used for a specific type of operation called the proximal femoral varus osteotomy. What they do is that they cause intentional fracture of the bone in order to restore the anatomical shape of the femur for patient who had dislocation and degeneration of the both hips, and also this to look the shape of the fork as well. And with another pin or nail, they put it to give more fixation and stability to the area.
And this always you will see with
Pediatric?
skeletally immature
This
patients.
skeletal patient, yes,
Mostly in
because
children.
yes. Also, this is very interesting type called the spider plate. It looks like a spider. They use it for patients who had carpal instability problems. For example, this patient had scaphoid fracture, and you can see the proximal part had osteonecrosis and non-union. So this gives us partial carpal fusion with 4 corners, and also gives stability for the carpal bones. Also, this another small specific type short plate used for patient who had metaphyseal fracture with 2 long cannulated screws above and below. Now, this another type or entity used for patient who had anterior cruciate ligament repair or reconstruction. First of all, I will explain this image because it has a lot of devices. First of all, this is called the interference screw. Basically, what they do is they make 2 tunnels. One of them in the femur, in the lateral epicondyle, and one of them in the tibia, exactly at the site of the anterior cruciate ligament. So with this interference screw, this allows more fixation and compression of this area. And another tunnel, they made it with another screw, but this is absorbable, radiolucent. You can see just a hollow of a tunnel in here, also a hollow of a tunnel in here. They pass the other allograft tendon or the new tendon in it, and they grab it out from the bone, and they clips it or fix it with staples. So basically, when you see screws and staples of the femur and the tibia, you suspect this patient had a ligament operation or reconstruction. Yes, this patient also on the medial epicondyle, he had also another surgical staples. This patient also had medial collateral ligament repair. As you all know, anatomically, the medial collateral, connecting between the medial epicondyle and the medial part of the tibia. So here there's a sort of injury and they fixed it as well. Another interesting type of screws, it's called the anchors. And basically they do it especially for labrum or glenoid injuries. So this patient had a Bankert lesion. For those who doesn't know, Bankert is anterior inferior injury of the glenoid labrum for a patient who had a common complication of anterior dislocation of the shoulder. So when this part is being injured, they put this anchors and they are connected to another wires. They fix it outside or to the anterior part of the chest wall, and they restore this anatomical part. So you can see how the anchors enter into the labrum to fix it in its sides. So this 4 anchors have been placed in here to replace this lesion. Another type of anchors here, who patient he had rotator cuff injury. Also, they put 3 anchors at the humeral head. Also, you can see there is evidence of healed left rib fractures. Another common device we see it a lot in practice, intramedullary nails. This is how they look like. There's the stainless steel, there's the titanium type, and allow also internal fixation for patients, especially who had comminuted fractures or multiple site fracture. For example, this patient had 2 fractures at the humerus, one of them mid and distal.
The stainless steel are contraindicated for MRI and the titanium is not. So you need to know the type of the wire before allowing the patient to go to the MRI machine.
This is the basic principle. Another type of intramedullary nails, but they put interlocking screws or pin above and below to give it more fixation. For example, in this patient, he had comminuted fracture of the femur, mid-diaphyseal fracture. This is another example also with intramedullary nail with 2 interlocking screws. Also, this is another example of intramedullary nail with 2 interlocking keels. Who patient he had tibial fracture, comminuted fracture. Also, this patient had a fibula fracture, displaced, but they didn't do anything. You can see also these lines. These are tubes called wound-vac drains. I think most of us see it in the surgical ward. Drain, yes. Also, this is a surgical staples, skin staples of previous operation. Another interesting type, they use it for the small bones or joint. This is small reconstruction plate with the small cortical screws. And this wire also, we will see it frequently sometimes. It's called Kirchner wires. Also, they use it for fixation for patient who had, for the first metacarpal osteotomy site. Now, this patient, he had change of first metacarpal injury. I don't know what did he had previous operation, but this allow very good fixation from both sides. Another type of fixator, which is called the Steinman pin. This is a very long pin. They use it for a patient who had also proximal humeral fracture, a comminuted type. Another type that's been used called Herbert screw. Also, they use it for a patient who had a small joint disease like rheumatoid arthritis. So they put it in the proximal interphalangeal joint for fusion. I have no idea, but I think they minimize the deformity of the rheumatoid.
And decrease the pain and inflammation.
Yes. Now moving to the last 10 slide, talking about the arthroplasty. Starting with the shoulder. This patient had hemiarthroplasty, proximal humerus prosthesis. Sometimes they only remove the head and part of humerus. Sometimes also they exchange or replace the glenoid as well. For example, in this case, this is cementless humeral head prosthesis, and this is a cement type glenoid component. And also this is how they look like. Some of them, as I said, with the glenoid, some of them only the humeral head. Yes.
Partial or total?
Total.
Either both sides total, either one side is partial.
Another type of prosthesis called radial head prosthesis. So they also replace the head when had severely injured or traumatized. And all with, you can see this is also, as we talked previously, Kirschner wires to give more stability. And this is called a tension band also. They give also more fixation and stability for the area. So this is called radial head prosthesis. Another type called, they use it for the small joint, radiocarpal or metacarpophalangeal joint arthroplasty, for example. In this case, look like two heads approximate each other, and one of them for the wrist also. Also give more range of movement and at the same time replace the joint from the second to the fifth metacarpophalangeal joint. This is the basic principle how they replace it, and part of it will be inserted intramedullary. This is also another example. They use it into the small interphalangeal joint with another intramedullary nail, put it in here, but this is a type of arthroplasty. This is a special type of also arthroplasty called trapezium prosthesis. As you all know, the osteoarthritis frequently affect the first metacarpophalangeal joint. So sometimes they do trapezectomy, is that they remove the trapezium and put this prosthesis to restore the range of movement of the thumb. Sometimes only the trapezium will be removed, sometimes the trapezium, and they put intramedullary part into the first metacarpal. And this is how they look like. Another type, hip arthroplasty. I think also most of us see it. Also, this is with a femoral head and with acetabular component. And also with another wires to give more also fixation, like circulage around the diaphysis. This is also another type. Now, the thing is that when we see arthroplasty, always make sure that it is in the normal anatomical site. Always look for the loosened zone that we see around it. Now, normally this zone should be within 1 or 2 millimeter. Now, if you see this loosened zone within more than 1-2 millimeter, you should suspect a loosening of this arthroplasty. Make sure also there is no any extra extrusion of the cement around the joint, outside here or here. Make sure it is not displaced. The alignment, always look for everything. Sometimes even a fracture of the prosthesis itself. This is another type of knee arthroplasty also. This one, yeah. Yes, it's called, it's radiolucent line, and as I said, 1 to 2 millimeter. More than 2, loosening of this prosthesis. You should suspect and report that. Knee arthroplasty also. For this patient, they had removed or replaced the both condyles of the femur and part of the tibial plateau. Also, this is by IP and this is bilateral. This is how they look like, and also this give also it's like a joint and give also range of movement. This is another type. They remove only the lateral epicondyle, and part of it also will be fixed on the tibia. This is a special type of also knee arthroplasty. Basically, the story is this patient had Ewing sarcoma, and they had to resect the distal part of the femur, all of it. So they made a special customed knee arthroplasty. They replaced the femur and also a joint and part of it into the tibia. The last slide took ankle arthroplasty. Also, they place it at the ankle and they fix it into the distal part of the tibia and fibula. And the other one is lying on the on the atlas with two long on the talus, yes. And with two long screws, they give it more fixation, and you can see there is fusion of the syndesmosis, tibiofibular syndesmosis. There is a healing, and of course there will be fusion. This is how they look like. Sorry. That's it. Thank you very much.
Thank you. Your effort is very obvious. Okay, Dr. Salus, can you help me please.
دكتور بوس دكتور أحمد
جيت the same one. Yeah. So we will have just very quick, let's say, tutorial or tour or whatever you like to call it. Dr. D prepared it. Okay. Ahmed, anybody needs قلم؟ تكون أعطيكم. Should we start? Very much, Dr. Sanusi. ها؟ اليوم فضايح. Okay. We'll do 20 slides, some of them just 30 seconds, just because we don't have time.
Yes.
And some of them maybe 1 minute. Dr. Dina will start.
Yes, only mention the name of the device. No.
No.
Just the name of the tool or device you are seeing. Bismillah.
اكتب اسم. لا أنا شو sorry. Just on the right.
Yeah, start.
Yeah, go.
Just name this tube that you are seeing.
Number
One.
Yes,
كذا.
first.
Two, كذا. Yeah, number one.
Number 2.
This is number one.
Slide number one. What's wrong with you? Oh, okay.
Number 2.
صور.
Okay, اشترك. Slide number 2.
Number two.
ما شاء الله مسيطر.
نكتب هاي اكو مختصر.
Name of the device.
This one.
Beside
This one.
ما ادري يطلع لازم يكون.
ليش ما يطلع point? Okay. This name of this.
Okay.
يصير مختصر.
3. Number 4.
This one. Five. Slide number 5. Slide number 6. What are this device? Twenty.
Stop. 7. قلت لها ديري بالك على جماعتك قالت
ايه ما من انت.
نكتب special name.
اكتب اللي تعرف. What's this?
What What is this and what is this?
جنان اشتغلي.
8.
8 number 8.
What is this?
Nine.
9. What is this?
Number 9. What is this?
The pointer. What is this? إيه بس هذا.
Ten.
What is this?
11. بس هذا 11 مو صح؟
10. 10.
10 sorry. 10.
Eleven.
Number 11. What's this? With the pointer. مو اكو وايد سؤال قاعد اسمع
لا
كذا.
والله.
ترى ما يصير. شراب.
12.
Number 12.
No, 12.
High 12.
قلتي؟
هذا 11.
هذا 11. كملتي؟
هسه 12.
يلا 12.
هذا 12.
Yes.
لا تخربط.
This one?
هسه 13 مو؟
Yes.
13.
This and this. 2. This is 1 minute. This one and this one.
So number 13 has two things, two devices, two
Catheters. Name of this, or this.
Again,
Name of what one?
بس مش راح يبدي.
Name of this and this, or this. This one the same name.
These
And
two are
this.
the same. What are they called?
And this.
And this one. So also two names. Two things. طيب 10 دقائق حسب.
زين اشلون اي وبي لوج
كيف؟
كيف؟
As you like.
$17.
Number 17.
15, sorry.
يعني اي وبي
15, sorry, 15. Now name 15, sorry.
Sorry.
ما عندي شيء قدم.
Yeah, 15.
I name this tube
Yeah.
or any other tube, and what is the complication? if you see.
Identify the tube and name any complication. Okay? هذا التيوب هيك اسمه complication صارت is this.
هذا 15.
ايه 15 sorry.
Number 15,
Yes,
yes.
15 sorry. Also name what is this device and if there
16.
yes and if there is any complication also.
Device and complication. هاي أسهل واحدة ممكن بيعطيكم.
Yes.
Good.
Yes, 16. Also name any tubes you see and any complication
17. Tube and complication.
or problem.
اثنين لو واحد.
Good.
اثنين.
You have two tubes, I think,
One
Yes.
of them
with some problem.
you mean
بعد من الجو.
ايه F3 whatever.
Yes.
عافية.
ايه gastric.
داري. جنان.
نفس
مو؟
diffuse
لا شو دكتور سيرفر ده يوصل.
يحرق لكم.
يلا. هاي قد هسه.
This is 18.
18. Okay. Name each device seen. عد. Yes. بيها واحد كذا، اثنين كذا، هذا كذا، أربعة كذا، خمسة كذا، ستة كذا. كيف؟ كم ديفايس موجود اسمها وبس. هاي هواية تجينا اكس رايات هيك، لازم تعرف شو كل يعني.
Next.
Each wire or device هذا آخر واحد ممكن؟
قبل الأخير بقى واحد. تمام.
تمام.
Last one.
Last slide, name each tube or device seen.
آخر واحد. نهاية يعني بس ما
يعني نكتبها بس كلمة.
بس
شو
أسمع.
تشوفين كتبي؟ أني تيوب أني
مو ملك نمتين ديك الفصيح من البيضة يصير ها؟
شكرا.
No idea.
حتى لا خايف